The sternoclavicular joint. This is the complete articular disc, the costoclavicular ligament, the inferolateral compartment, the superomedial compartment is here on top, and the interclavicular ligament. Features of the sternoclavicular joint. The sternoclavicular joint, also called as the SC joint, is a synovial joint. It is a compound joint formed by the medial end of the clavicle, the clavicular notch of the manubrium, and the upper surface of the first costal cartilage. So this is the medial end of the clavicle, the clavicular notch of the manubrium, and the first costal cartilage. It is a complex joint as its cavity is subdivided into two compartments, the superomedial and the inferolateral, by an intra-articular disc. So this is the superomedial compartment and this is the inferolateral compartment, which is divided by the intra-articular disc or the complete articular disc. The articular surface of the clavicle is covered with fibrocartilage, as the clavicle is a membranous bone. The surface is convex from above downwards and slightly concave from front to back. The sternal surface is smaller than the clavicular surface. It has a reciprocal convexity and concavity. The sternoclavicular joint is classified as a saddle joint because of the concavo-convex shape of the articular surfaces. The capsular ligament is attached laterally to the margins of the articular areas on the sternum and on the first costal cartilage. It is strong anteriorly and posteriorly, where it constitutes the anterior and the posterior sternoclavicular ligaments. However, the main bond of union at the sternoclavicular joint is done by the articular disc. The disc is placed laterally to the clavicle, on a rough area, above and posterior to the articular area for the sternum. Inferiorly, the disc is placed to the sternum and to the first costal cartilage at their junction. Anteriorly and posteriorly, the articular disc fuses with the capsule. The interclavicular ligament passes between the sternal ends of the right and the left clavicles. Some fibers are attached to the upper border of the manubrium. The costoclavicular ligament is attached above to the rough area on the inferior aspect of the medial end of the clavicle. Inferiorly, it is attached to the first costal cartilage and to the first rib. Blood supply of the sternoclavicular joint. It is done by the internal thoracic and the suprascapular arteries. Nerve supply of the sternoclavicular joint is done by the medial supraclavicular nerve. Movements of the sternoclavicular joint can be understood by visualizing the movement at the lateral end of the clavicle. These movements are elevation, depression, protraction, retraction, anterior or posterior rotation of the clavicle is utilized in overhead movements of the shoulder girdle.